So good afternoon, ladies and gentlemen, to those of you in the room and to those of you listening online. It's a real pleasure to welcome you to this multi-stakeholder workshop on shortages. And this is a workshop that is co-owned by the heads of medicines authorities across Europe and the European Medicines Agency. And actually, it follows a meeting of the Task Force on Availability of Medicines, which took place this morning. So it's my pleasure, Emer Cook, the Executive Director of the European Medicines Agency, it's my pleasure to open this important workshop on shortages. So I'm very pleased that we're able to welcome so many people in the room, but also so many people online, from patients, consumers, healthcare professionals, learned societies, industry, academia, regulators, and of course, other health related decision makers. I think I don't need to tell all of you that shortages and medicines availability is a key priority, not just for EMA and the heads of medicines agency, but it's a key priority for European patients and citizens. And in recent months, we have witnessed how shortages can really affect the European population and become a real public health problem of significant concern. So one of the discussions we want to have today is really how we collectively get together to make sure that we mitigate and manage potential shortages of medicinal products. Of course, we're living in very, very challenging times, and the recent geopolitical events, such as the war in Ukraine, the rising energy crisis, the inflation rates, the increasing respiratory infections over the last couple of months have all led to an increase in the number and severity of shortages that we've observed across the EU. And this isn't just in the EU, this is a global problem. And it's something that we try to address at a European level, but we need also to make sure that we have connections in a global context as well. So it's not that we were unprepared, because for several years we really have been building new tools and structures to intensify EU cooperation and improve our capacity to respond to shortages. But the experience of the recent months has shown us that we still have more to do. But we also have some newly created structures that are helping us to manage particularly the critical shortages, and we have opportunities that we hope will be presented by the new pharma legislation. So in addition to strong collaboration between authorities, it has become very clear that strong collaboration with all stakeholders is extremely important. And this is a pillar that we need to build on to make sure that we have the optimal future system. And this is one of the reasons why we're here and why we have so many stakeholders from different fora with us, because everybody is a part of this collaboration. We need to make sure that we together work to inform, to communicate, and to mitigate and to manage. I would like to reference in particular the medicines shortages steering group, the the new group created in the context of the of the extended mandate of the European Medicines Agency. I have the pleasure to co-chair this with Professor Broich, and it's really been a wonderful forum to get timely information and to really help us to achieve a coordinated approach, really formalizing a lot of the less formal discussions we had at the beginning of the pandemic, where we were seeing huge shortages, particularly of ICU products, and there wasn't any formal coordination mechanism at that time. We've also seen the launch of the EU Joint Action for Shortages, which improves capacity at national level to enhance national systems in tackling medicines shortages in a harmonized way. And I think the work ongoing in the single point of contact working parties, both from the authority side and from the company side, is really helping to ensure that we have the correct the structures in place to help us manage and improve security of supply. So I want to emphasize that the Heads of Medicines Agency and EMA are working with member states and stakeholders, including industry associations, to help identify availability issues early so that we can take the necessary mitigating actions. And it's very important that patient and healthcare professional organizations also provide us with this information so that we can ensure that this is shared across the network, and we can together try to come up with some actions. We're also coordinating from the EMA side. We're working closely with the European Commission. We have DG Sante represented here today. We've also got DG HERA online, but we're also working with DG GROW to see what additional measures might be needed from a more long-term perspective. So our long-term vision is to shift our focus to become more preventive and proactive so that we can better anticipate and manage emerging situations. So let me conclude by underlining the importance of the timing of this meeting, because we've actually had this in the planning for quite some time. It was going to be effectively a routine stakeholder meeting to address the issue. But I think the fact that we have been challenged so much over the last couple of months really makes us it makes this very timely and means we have the opportunity to think in a very pragmatic way about what needs to be done by this big community that we have together. So I really hope that you will use your voices to help us manage how we go forward and so that we can play this proactive role, we can play this anticipatory role in trying to manage and mitigate shortages and improve the availability and access of medicines to all European patients. So with that, I would pass over to the two co-chairs of our task force on availability of medicines. This is co-chaired by Hugh and by Monica, and they chair the task force, but they will be also co-chairing this meeting. So thank you very much.
So thank you, Amer. It is also my pleasure to welcome everyone to this important meeting, which I will be co-chairing with, together with Monica, yes. But before I go into the details of the workshop, I would like to remind everyone that this HMA-EMA task force was already established in 2016 to develop and coordinate actions for better prevention, identification, management of, and communication on issues that can affect the availability of medicines in order to improve continuity of supply for both human and veterinary medicines across Europe. Improving the availability of human and veterinary medicine authorized in the EU is a key priority for the European network. Shortages and availability problems are complex with no quick solutions. Medicine regulatory authorities are only one of the many actors involved in availability issues. However, they play an important role in their prevention and management. By bringing together experts from various EU member states, the work of the task force lays the foundations for an improved and harmonized EU approach in addressing the problems of medicines availability issues. The task force is designated to function as a supply and availability hub, tracking progress on the medicine availability and shortage-related activities that the European Medicine Regulatory Network is undertaking. The main priorities of the task force include looking at ways to minimize supply disruption and avoid shortages by facilitating approval and marketing of medicine using the existing regulatory framework, developing strategy to improve prevention and management of shortages caused by disruption in the supply chain, encouraging best practices to prevent shortages, improving sharing of information and best practices among EU regulatory authorities to better coordinate action across the EU, and finally, fostering collaboration with stakeholders and enhancing communication of supply problems to EU citizens. As Emma already mentioned, we had the first multi-stakeholder workshop with the HMA task force back in 2018, and we are very much looking forward to take stock of the current state of play and to discuss the task force deliverable with you. In this context, the aim of the workshop are to inform you about the activities of the task force on medicine shortages and availability issues and how these interface with other many initiatives. Update you on the progress of the deliverables and identify area of agreement as well as area for further discussions. Get your perspective and initiative to address availability issues and discuss how these can contribute to the future deliverables of the task force. We will start today by setting the scenes and contextualizing how the task force is tracking progress on the medicine availability and shortage-related activities that are taking place at different levels. We will then separate into 3 groups and dive into the parallel breakout session addressing the supply of immunoglobulins, biosimilars, and medicine for veterinary use. All participants have been given specific instruction for their rooms and WebEx links, so please keep this at hand during the coffee break so we can start sharp at 15:25. Tomorrow we will reconvene at 9, and after hearing the key take-home messages emerging from the breakout sessions, we will discuss 3 main topics: prevention of shortages, permanent withdrawal from the market, and communication and transparency. We will then conclude the workshop with a panel discussion where we will invite all speakers and participants to share their thoughts on 3 questions related with work ahead for 2025. I look forward to the discussion ahead and give now the floor to my co-chair, Monica Diaz.
Thank you, Hughes. And it is my pleasure to welcome everyone in the room today, as well as those that are connected via WebEx, and also those that are following the live broadcast. Now, I think it's time for us to move to the first session of today. And it is my immense pleasure to introduce the session moderator, Karl Breuer, here to my right-hand side, President of the Federal Institute for Drugs and Medical Devices in Germany, the BfArM, is also the chairperson of the Heads of Medicines Agencies Management Group, and very important, is the co-chair of the Executive Steering Group on Shortages and Safety of Medicinal Products, the so-called MSSG. So, welcome, Karl. Thank you for joining us today. And I now hand over for you for the session introduction.
Yeah, thank you very much. So it's a great pleasure for me to be here today. And thanks to the chairs and to Emer for this. And I'm very pleased to see so many interested people here in the room and remote on this indeed very timely topic. So setting the scene will be important today. Where are we? Where are we coming from? And what are solutions in the future? So you heard it, improving availability, accessibility of medicinal products here in Europe is key to us as regulators. We are only one part in the system. However, we are dealing now since many, many years with shortages on the national level, on the European level, and as well on the global level, as we have learned in the pandemic situation. So since 2016, the task force is dealing with this, and here a warm thank you and a thank you to all of the people working in this task force since years now. And the lessons learned from this task force have been very helpful then developing the system further. So as Emma mentioned here in her welcome note, we are not unprepared. We are prepared, but not enough. So the pandemic situation with shortages of treatment in the beginning without real treatment options, the shortages, particularly for ICU, then medications like propofol, sedative drugs, and so on, and particularly the recent issues with the Ukraine war, then the increase of pricing with the then costs of energy, all these things making things even more difficult. So we have to do more, and we will do so together. There's one key lesson learned from these recent crisis situations, and Emer mentioned it as well. We can tackle that issues only if we are doing it together, all stakeholders, not only we as regulators, not only industry. And this is the key to solve issues. We need the network on the European level. We need as well the networks at the national level, because there the local situation has to be addressed as well. It underpins what we can do, and we have our experience, and I think we see examples today in the presentations what we can do and how we can improve and prevent in the future as well. With the new mandate of the EMA, we established the Executive Steering Group on Shortages and Safety of Medicinal Products, the so-called MSSG. And I think this has been based on the experience in the network in the beginning of the pandemic situation, where we did it, as Emma mentioned, in a very informal way to address these issues. Now we can do much better, and we have then all the data and numbers provided by our SPOC working party. And here a big thank again to all this work done so that we can do it. And the important thing is with the MSSG, that is the steering character of this group. There are the executives of the EMA, of the national competent authorities, and here we are working together to find the best solutions. And I can reassure you that HMA is a strong supporter for this work, and we keep here together with all the stakeholders. I think only together as an active and cooperative network we can tackle these issues. So we will address in this setting the scene session where we are coming from, which activities are ongoing and what is needed in the future. You will hear in some statements as well. And we start now with the European Commission. I'm very happy that Sylvain Giron is with us here today, and he is the head at DG Santé on medicinal products, quality, clinical, and safety. And so, Sylvain, the floor is yours.
Ladies and gentlemen, good afternoon. Carl, thank you very much. Dear colleagues, dear friends, and anyone interested in medicines this afternoon, it's my pleasure to be here to tell you how we work on these issues at European level with the European Medicines Agency, the national authorities in coordination, and of course, from the Commission perspective. So, shortages at EU level, I don't need to tell you, have become a problem. We have perceived that very much during the COVID crisis, but that had been a problem for several years before. And in fact, the need for coordinated action and collaborative approaches across the EU is something that has been recognized, and even more recently recognized at the highest political level, that we needed to put in place together more structured, interconnected system founded on robust information to address the challenges that are associated to the medicine supply chain. So we have learned a lot from the COVID crisis and the shortages that we were confronted to during that time in times of crisis. And as it was already referred to by the previous speakers, the European Union system reacted with a proposal that the Commission issued to extend the mandate of the EMA to give the agency a stronger capacity to coordinate issues in relation to shortages. This took the form of a Council and Parliament regulation adopted in 2022 that reinforces the system and creates processes to address shortages, to monitor, to mitigate, and also to a certain extent prepare and prevent specific situations of crisis shortages. And my colleagues have already mentioned these mechanisms, the steering group, the MSSG, the SPOKE network. They've been working and they've been developed and are now working full speed. In fact, these mechanisms and these tools have demonstrated very much their effectiveness through the remaining of the COVID crisis, and also most recently in the situation of monkeypox. There is also another element of crisis management that took place as a follow-up to COVID crisis, and that has a relevance for the shortages. There was the creation in the Commission of a new Directorate General that is specifically looking at medical countermeasures in times of crisis, and this also is relevant from the perspective of availability of these countermeasures and their accessibility. Later on in the program, there will be also colleagues from this Directorate General, DG HERA, that will that will intervene. Let me also say that in addition to crisis management, so I mentioned COVID, of course, I mentioned monkeypox, the structures that have been put in place by the extension of the EMA mandate have also showed or have also demonstrated that they are important in terms of preparedness, and the current situation of critical shortages for antibiotics showed that the agency and the member states, and so the Commission, have been able to coordinate and work together using these robust systems and processes established for crisis time in a way that they are useful also to manage that situation of a more structural situation of shortages. So as it has been already highlighted by the previous speakers, these mechanisms really help establishing a proper framework, proper channels for discussions with industry, to identify root causes, to develop mitigation measures, to coordinate across across member states, between national authorities, and to learn lessons and improve as we develop actions in the system. But in addition to these emergency situations and the tools that have been put in place for to address crisis, there also been an attempt from the EU level to address some of the shortages from a more systemic, structural perspective, and trying to look at the system altogether and how it creates such situation. So this has taken the form of working on both legislative and non-legislative initiatives that have been developing through or from the Pharmaceutical Strategy for Europe that the Commission published at the end of 2020, and which has been our roadmap since then to develop actions on pharmaceuticals. So beyond the crisis context, the pharmaceutical strategy has had already indicated that they would need to be working, there would need to be further work on addressing the vulnerabilities of supply chains of medicines and the need to address root causes of shortages, structural shortages. The Commission had commissioned a big study on this a few years ago, and this pointed to the challenges with harmonization, consistency, and quality of reporting. But it also showed that many root causes of shortages are also linked to other dimensions of the life cycle of medicines, like quality and manufacturing issues. There were also commercial reasons, including the possibility for market authorization holders to withdraw from certain markets, also a certain number of the way that surge unexpected surge in demand were affecting the capacity of the supply chain to deliver. In fact, this study, which I invite you to look at if you haven't yet done so, proposed 16 areas for recommendation where and these were very much also similar to the work that had been initiated and planned in the task force that was referred to and the work that was mentioned earlier. Another initiative that we took in the Commission, it was the structured dialogue on supply chain of medicines, on the security of supply chains of medicines. This was a process through which, together with industry, national authorities, patient, healthcare representatives, academia, different participants, we tried to gain a better understanding of the supply chains of medicines. What type of vulnerabilities do they have? What sort of strategic dependencies do exist, and how these different vulnerabilities indeed concretely and directly lead to these structural situations of shortages. As a result of that process of interaction, consultation, the Commission published at the end of last year a policy paper, we call that a staff working document in our jargon, which suggests a certain number of policy directions for further policy development. And this document in particular proposes in sort of concrete follow-up to identify through an EU list of critical medicines where to identify, once we have identified these critical medicines, to actually review for each of them or a certain number of them analyze their supply chain and analyze the different steps in that supply chain that creates possible vulnerability, including dependency from third country, for example, but not only. And on that basis, try to prevent by looking at what early measures or changes in practices could be envisaged. In parallel, the Commission has announced that it will also revise or propose to revise the EU legislation, and as it has already been mentioned, the revision of the legislation is in preparation, and as probably many of you are aware, the Commission's proposals are due to be made available or to be adopted by the Commission later this month, so in a few days and weeks now. We have said in the pharma strategy that we would, in that revision, include and consider revising some of the legislative provisions in relation to supply chains to also improve the situation from that perspective through the legislation. Of course, the legislation can't do and can't fix everything here. The legislation is just one of the different tools that we can use. What we said we would do is that, well, I'm not going here to tell you what's going to be in the proposal. You will have to wait for a few weeks. But what we said we will do in the revision is that we would look at what sort of new measures or reinforced measure could be put in place, including stronger obligations for supply and transparency, earlier notifications of shortages, earlier notification of withdrawals, enhanced transparency of stocks, stronger EU coordination mechanisms, reinforcement of monitoring and management of critical shortages situation. As you know, this Commission proposal has been developed over the course of several years, and including through processes of consultation and discussions with the member states and with all the different stakeholders. And also it is relying on the information that was provided to the study I mentioned before and the structured dialogue that I mentioned before. To support that process, also the Commission has suggested to the member states to use financial support from the EU for Health program, which, as you may know, is the financial instruments for health policy at EU level. And there is what we call a joint action for 10 million euros over the course of the next 3 years for national authorities to continue to build their capacity to engage in coordination and cooperation at EU level and to be involved in the different types of mechanisms that I mentioned before. So let me finish, dear colleagues. I just wanted, before I finish, to draw your attention to a few of the elements that are on the agenda of these 2 days, and which, from the Commission perspective, from DG Santé, we think are very useful. First, later this afternoon, in one of the breakout sessions, you'll be looking at immunoglobulins and their challenges of availability of these products. They're very special products, and they're also linked to another legislation that we have in place at EU level on substances of human origin. And of course, they are very special also because they come from products that are unpaid and based on unpaid and voluntary donation of patients. So the second breakout session this afternoon, another breakout session, is on biosimilars, and here also it's a very interesting subject, as it is at the intersection of different issues that we have highlighted in the pharma strategy. the availability, the shortages issue that we are discussing here today, but also more generally the issue of affordability of medicines and how medicines are to be part of the discussions on the sustainability of our health systems across Europe. And this is something that is also discussed between the national authorities for pricing and reimbursement that also have their mechanisms of cooperation at EU level. And then, of course, tomorrow, many interesting discussions on the prevention of shortages, on risk role, on communication, transparency, and so on. And that will be very interesting for the Commission to hear your feedback as stakeholders, your views, and your collective recommendations. So, as you can see, there are many ongoing processes at EU level between national authorities, with the EU institutions, with the EMA. And our focus from the Commission has always been to avoid duplication and ensure complementarity, and certainly avoid unnecessary burden on national authorities and stakeholders. We believe that patients across the EU must have access to the medicines they need. And when they are actually accessible, authorized on the market, they must be able to access, or they must be available without discontinuity of supply, to avoid any uncertainty in treatment for patients and for health professionals. So to be successful in this, our objective must be to deliver for all the different many players in this system. And your feedback, your insight, the information you're going to share over the course of the next 2 days, or this afternoon and tomorrow, is very useful, and we're looking forward to hearing from you. And on that basis, I'd like to wish you a very productive 2 days, and thank you very much.
Yeah. Thank you very much, Sylvain, for the views by the Commission and what is meant and what we can expect in the future. So we have organized this session that we don't have questions now, but we will discuss at the end. So it's now a great pleasure for me to introduce Lorraine Nolan, the head and chief executive of the Irish HPRA. So she is as well the chairperson of the management board here at the EMA, and she is one of the experienced leaders in the HMA network and working within the task force on shortages since years as well. So this is part of our strategy 2025 and part of the multi-annual work plan of EMA and HMA. So Lorraine, the floor is yours.
Thank you very much, Carl, for the introduction, and good afternoon, everybody. First of all, I'd just like to say that it is a huge privilege for me to speak to you this afternoon in what I think is a really fundamentally important workshop on the topic of shortages, because I think every one of us would agree that shortages are absolutely essential to healthcare provision, but also the fact that this workshop brings together so many involved stakeholders. And the final point that I just want to say, right workshop at absolutely the right time. And I think the timing of this is pertinent for many reasons that the colleagues that have spoken before me have outlined. But I think particularly also the recent experience with winter surge and the availability issues that we have experienced with antibiotics and other medicines as well. Now, I do have slides, and you might realize as I deliver this presentation that technology may not be my strongest point, but this is looking good. So you should see some slides on the screen now. So first of all, Sylvain has really well outlined the developments that have taken place at European level with respect to medicines availability and the management of shortages. And as Carl has outlined, my role in this opening session is to really set out the role of the national competent authorities, the regulators across the heads of medicines agencies, our priorities, our focus, and how we fit in this system. And the first thing I do have to say on this is that it is the case that the vast majority of shortages are monitored and managed, reacted to, mitigated events, and even prevented at the member state level. And I think the member state response is always going to be at the core of the management of availability issues and shortage response. And that in many levels just makes sense because it is so closely related to healthcare provision, how medicines are supplied into the marketplace, choices around use of medicines. All of those things are decisions that are made at national level. However, that being said, I think the enhanced coordination and the developments at European level, the expanded remit of the EMA, are all very, very welcome developments. And it really is through a partnership approach between the national agencies, the European Medicines Agency, the Commission, and HERA, working together in the area of medicines availability, but also in crisis situations, the preparation for crisis and response, which are absolutely critical. And I think the coming together of all of those initiatives is really what benefits patients. It's been said a little bit as well already, but I will go back over the point because shortages and medicines availability for us as regulators is a different kind of area because nobody really nobody really owns the issue in its entirety. So it is an area that we work in where we have huge interdependencies on others. And I've mentioned healthcare delivery and I've mentioned healthcare systems. Of course, the industry is the other absolutely critical stakeholder in this because it is the industry that makes the medicines available and makes them and supplies them into the marketplace. And even if we look at some statistics from a manufacturing viewpoint and a quality defect and viewpoint and supply chain interruption, they are the reasons behind 50% of shortages. So we all need and we all depend upon each other to be effective in this area. The other point that I would really like to make is there is a difference in managing medicines availability and shortages in what are routine situations and what are more major event public health emergencies. They require different processes, they require different interactions, and they also require different responses. And I think one of the things the European system has done extremely well over the last years has to actually put in place the infrastructure to be able to manage those situations differently. And on the slide there, I have attempted to diagrammatically represent this because I'm sure to many of you that are listening today, it may feel at times there are lots of groups and it may feel at times that it's not exactly clear which group does what. So what I've tried to do in this diagram here is to separate out the routine or the peacetime from those more crisis-driven situations. And the MSSG, and I won't go into the full name for the group because it is a little bit of a mouthful in terms of the acronym, is the key group that comes together in crisis situations. Its composition uniquely positions it to make swift decisions and ensure the coordination of actions. And then we have the more routine peacetime activities. And you'll see in that I have straddled across the middle of the two areas, the SPOC working party, the single point of contact working party. This for me is really about the intelligence, which is a bit of a giggle as well too, because if you're a bit like me and you're a Star Trek fan, you will remember Spock and you will remember that he was the intelligence machine. Well, Spock is a little bit like that because it is really all about gathering the information, monitoring availability issues and identifying those issues that may escalate into problems. And that is its role. So it has a role in crisis preparedness as well as what I would consider the routine. It also makes recommendations into the MSSG. And then under the peacetime, we do have a number of groups working in that area. First of all, the task force and the thematic working groups, and the Chessman Joint Action, and also the network strategy that Carl has outlined. For me, these are really about the strategic development. These groups are focusing on the future and looking at how we advance and develop in this area. So on that note, I do want to speak a little bit about the European Medicines Agency's strategy, or the joint network strategy between both the HMA and the EMA. We have one, and we also have a multi-annual rolling work plan, which runs alongside the lifetime of the strategy, bringing us to 2025. There are a number of key thematic focus areas in that strategy, which are shown on this slide, 6 in total. And one of them is access and availability of medicines. Really important point for me to make, particularly as I see Ivo moving across the back of the room there. Medicines availability and shortages, when we speak about it, we often immediately go into the mode of medicines for human use. The focus here also includes veterinary use because there are very unique and specific challenges to that sector as well too. So the strategy and the multi-annual plan has that focus on both human and veterinary medicines. For each of those thematic areas, there is a lead, a HMA lead and an EMA lead, and I have the honour of being the HMA lead for availability and accessibility of medicines. 2 goals under this thematic area. First of all, goal 1, which is shown on this slide, is around strengthening the availability of medicines to protect the health of EU citizens and animals. So that is the availability goal. And then the other relates more to accessibility, which is optimizing the path from development escalation through to access via collaboration. For the purposes of what we are really focusing on in this workshop, no surprises, I'm going to stay within the area of availability. And availability has to be a key area of strategic focus. It's been said through the presentations in the introductions that we are seeing an increasing prevalence of shortages. It's also the case that many of those shortages, and probably more on the majority side of them, do relate to off-patent and generic medicines. National health systems have critical dependencies on generics and off-patent medicines. Even in Ireland, by volume, 70% of the medicines used in our health system are generic medicines. So this absolutely has to be a critical focus. And the other thing to say is the number of actions that we do have under the multi-annual work plan, they do focus on strengthening member state systems and member state approaches by building up on what the national competent authorities currently do. And a number of them then relate to that European coordination piece and ensuring the development and the evolution of that as well. So a little bit more detail on the focus areas under the strategy are shown on this slide. Probably it divides into 2 key areas, and the first is shown on the bottom of the slide, which relates to shortage management. So under that umbrella, we have a number of activities which are already in progress and in train. The first of those relates to the evaluation of best practices, and then following from the best practice evaluation, developing strategies to implement those practices across member states to improve and enhance the approaches that are taken at member state level, but also to bring about that harmonization and coordination on the actions that are undertaken, the exchange of information, and also the communication piece. And I will say that one thing we are really seeing within the network is the increasing sophistication of the systems that are in place at member state level in relation to the management of shortages and monitoring of medicines availability. You know, there are very sophisticated technology tools and uses that are out there. So there is plenty of best practice experience. We, of course, are not just focusing on the best practice experience within Europe. We are looking into internationally to regulatory approaches there, and also the approaches across other stakeholder groups as well too. The types of issues that will be considered under the best practice analysis include how intelligence and information on shortages and medicines availability is gathered, and then once a shortage occurs, how is that operationally managed at member state level, what technology, what tools are utilised, but also how the engagement with other health stakeholders, which is absolutely critical in this space, takes place. And another focus area then, not surprisingly, is communication and engagement on those areas as well. So again, this in terms of taking this forward and who is doing what, very much so a cooperative approach here between both the task force and the joint action as well, both working in cooperation to push forward the actions that are under this area. But an important point to make here, and I know it is one that Sylvain has highlighted and it will come out during the discussions today, the joint action is very much so focused in building the capacity and the infrastructure at the member state level to enable them to develop and enhance their practices and their approaches. And just before I leave this point on practices and approaches, I do want to give a quick mention to the European Shortages Monitoring Platform. And I know that may be covered under other presentations. No need to explain to any of you the incredible capability that a system like that will give us in terms of monitoring and managing shortages. And it is an action that is included under our strategy. Progression of the development will take place through the EMA, but it is a system that's intended to be interoperable, and the joint action and the task force are also focusing on the development of a European IT concept model, which takes into account the practices and the technologies that are used at member state level to ensure their information and their systems are mergeable within that system. The other area that the strategy focuses on, and it really kind of is set out in the top two quadrants of the diagram that is shown on your slide there. And I think this is the really exciting and the difference in this strategy is the focus that it places on prevention. So again, a number of activities are already started in this area and the work is ongoing. The first of those involves a root cause analysis of the contributory factor to shortages, looking at this from the perspective of medicines that are still covered by patent protection and generic off-patent medicines, to see what the differences in those contributory factors are. And this is all about increasing our understanding. Following from that, then, the intention is to make recommendations for the development of strategies to improve the prevention of shortages. And it will include, possible suggestions and areas where European legislation and national legislation can be enhanced. And I know Sylvain has mentioned the pharma strategy or the pharmaceutical legislation. That, of course, is another opportunity to combine and look at this area as well too. So there is a huge amount kind of happening within this space. There are other actions under the strategy and regulatory activities, which we all know do have a preventative role in terms of preventing shortages from occur. They are included there. There are examples such as the electronic product information roadmap and also the promotion of multilingual packs. So these are routine regulatory activities that are already in train, but they are captured under this umbrella as well too. And I know very much so what I'm speaking about, and I know many of you, depending on the perspective that you are coming into today's discussion with, will be thinking about, the need for legislative changes, the need for policy changes, the need for different regulatory approaches. I think it is an important thing to really reflect on. We can do a lot more with the current system that we operate in. And this is something that I'm always mindful of in the areas of shortages, because as an agency, we constantly analyse, we constantly look at root causes. And although this isn't a root cause in itself, one of the things that we consistently see is a factor in all shortages is delayed notification to us. So if the information on a pending shortage is late coming into us, that really impacts on our ability to mitigate against it, because you're kind of behind before you actually can begin. So there is an awful lot more that we can do by working better together. And it goes to speak about the theme of partnership, which is, I guess, what this workshop is fundamentally about too. So the next slide is really a little bit to just explain why I really do believe in this strategy. I really believe in the work plan, and I believe in the achievability of everything that is set out in it. And we are aiming for success. It is our second strategy, and in comparison to the previous one, it definitely calls out prevention in a very different and a very front-facing way, and I think that is a really positive development. It's also the fact that every single action in it is really carefully mapped to the work plans of the relevant network committees and all of the working groups under it. We've also spoken throughout the presentations that have been delivered so far. Everybody has discussed about the changes in the structures that have happened, the various groups that have been established, and that gives a governance structure. So the coordination between the SPOC, the task force, and the joint action is particularly important, because that's ensuring that every single action we have is mapped and they are coordinated, and in that way that we are constantly tracking to ensure we're avoiding duplication. The other thing that I would say in terms of the management of the strategy and its work plan, and I've mentioned HMA leads and EMA leads, we have put in place a very strong process for continuous review. So actions are reviewed and they are adjusted all of the time to take account of progress. And that again is another way of looking to make sure that we are coordinating properly and that we are avoiding duplication and ultimately to ensure success. But it also has been a very fast-paced environment in terms of development in the lifespan of this strategy so far, so absolutely critical that we would do that. There's a huge amount of interlinkage between all of the thematic areas, because in one way or another, many of them do contribute to the area of medicines availability, supply chain, data analytics and innovation. And then health system partnership is the other thing that I just do want to really call out. I think we've all seen from the experience of the pandemic in particular, that the huge importance of strong interaction between regulation, the industry, and indeed how healthcare is delivered. Because if we do not understand the dependence of our health systems on medicines, the supply chain and the vulnerability we can't mitigate. So that is absolutely critically important. And finally, on my last slide, because I know I just have 15 minutes in this, so I do need to move on, I just want to schematically show the joint action to you. My reason for including this is really just to show you the totality of it as a project. So you will see in this a number of horizontal and a number of vertical work packages. Horizontal work packages are those that are really put in place to support the structure of the products. The vertical work packages are those that are really aligned with its objectives. And really my point in this slide, you can see the close alignment between work package 5, the identification of the root shortages, work package 6, the identification of best practices, work package 7, the digital information exchange, and work package 8, the prevention focus as well too. So with that, it concludes my talk. Happy to take questions during the panel, and I'll hand back to Carl as our chair.
Thank you very much, Lorraine, for showing us what can be done even in the framework or within the legal framework as it has been outlined by Sylvain earlier. So we can do a lot even for the time being. And with that, we will come to the next presentations. How are we doing it? And here we have two presenters. First start will be Anthony Humphreys. And then thereafter, Agnes Marta-Molnar from DG HERA will come in. Tony is here very welcome and very much known as Head of Regulatory Science and Innovation Task Force. Please, Tony.
Yeah, thanks very much, Carol. And I hope everybody can hear me okay. That's very good. First technical challenge. The second technical challenge, can I get my slide deck up, please? Very kind. Okay, so I'm just following on now from these sort of introductory presentations, and I'm trying to set the scene with regards to what we've done over the past year, and then indeed being complemented then by Agnes from HERA, and to try to see how this complementary type action then plays out. I don't know whether you realize, I mean, an accident of timing, it's actually on the birthday of the regulation, the 1st of March 22. Here we are, the beginning of March 23. So we are still in our infancy in terms of learning how to apply this new piece of legislation, which has been simplistically numbered 1, 2, 3, but certainly doesn't address a simplistic challenge in terms of the complexity that the previous speakers have sort of highlighted. The key benefit that we're hoping to get from the successful application of this regulation, of course, is more and better coordination in preventing and mitigating medicine shortages in the EU. And I believe a number of the former speakers are emphasizing that preventative, hey guys, you know, we're all about supply and availability. And really when we have shortages, then, you know, that's to be regretted. And this isn't like, but some pieces of legislation are built on theory, built on future potential, but this one has been built on essentially a very robust proof of concept that has been the COVID-19 experience. And indeed, many of the structures that the Commission have then put in place actually have been built on the rather voluntary, successful cooperation amongst the member states. Just touching on what Lorraine says, we can do a hell of a lot with existing frameworks, even without an explicit direction. And that's been built upon, I think, in the construction of this new regulation. And in particular, of course, we have established the Medicines Shortage Steering Group, and Carl emphasized the fact that this is an executive, a leadership steering group, very much to give strategic and tactical direction in trying to address these problems. Lorraine has already highlighted the establishment of the Working Party of Single Points of Contacts in the member states, the SPOC. I was going to say that they do the donkey work in the system, the heavy lifting, the grunt work, but she has a much more nicer image, which is the Intelligence Center, the SPOC, and reference to Star Trek, etc. And I think both, you can look at both elements. They're a key structural function in the operation of this new regulation. Not to discount, however, the network of contact points from the pharmaceutical companies. Emer touched on this in her highlights opening, saying that we can't do it. Of course, we have to do do it with the producers, with the suppliers, and the successful activation and the active engagement from those producers and suppliers is really critical to the success of any of our efforts to achieve the supply and availability target. Okay. This sort of schematic, and I think Lorraine has already covered it, it's just a simple representation. On the left-hand side, you have the rather formal role, crisis preparedness, public health emergencies, major events, and that's where you see this new structure, the MSSG, showing up largely. On the right-hand side, so-called normal circumstances, but unfortunately, normal circumstances bring the challenges of supply and availability challenges, and that has been the meat and drink of the task force since 2016, as Hugh has highlighted, but is now becoming ever more a collaborative effort in terms of how do we address it. You see already there the sort of bridging role of the SPOC working party, that intelligence function between the MSSG and indeed the task force with its policy ambitions. We are very much trying to implement a legislative gift, the extended mandate, 1 year old today. Sylvain has also touched on the pharma strategy, and we know that will land in terms of the formal release of the proposals end of this month, and we will see how this whole sort of landscape evolves. And it's very much the balance between normal circumstances, preparedness, and then as and when then we trip over into any major events or public health emergencies. Underpinning all of this is our collaboration with the Commission colleagues here at Sante, ECDC with regards to epidemiology of various diseases, etc., and the effort on the joint action on shortages, the Commission's underpinning investment through the Chessman that Lorraine has talked about. The idea is that just increases the capability of this sort of system overall. Okay, I wanted just to remind you of the key milestones here, and I'll go very quickly. I've already touched on the first box there, the actual establishment of the governance structures. And we've established processes. We are beginning to monitor events, or have been monitoring events under this new regulation. And we have been monitoring in the more formalistic way the shortages with regards to establishment of critical lists, etc. And I'll speak a little bit more on that. But the remainder, if you go to the right of that diagram, we're on literally at the moment in the middle of this month, we'll be establishing mirror type executive steering structures for medical devices, and indeed a sort of SPOC for medical devices as well. It's very much mirroring the sort of ambition in the medicines field. And Lorraine has already touched on the establishment of the ESMP. The target is to get that at least minimal viable product up and operating February 25. And that's only the end of the beginning, because that then is a capability or a capacity we have to do a better job in this area. It's certainly not a game over time point. If I can just briefly touch on, because I really do want to focus the rest of the talk on the preparedness type activities that we do. We are focused on, there are some very explicit provisions, what happens when you're in a public health emergency, and you can wait for 10 or 15 years before you have one of them. And then lo and behold, last year we were sort of gifted with a second one, a little bit unexpectedly, with the form of the MPOX, as we now call it. And much and all as maybe the heat has gone out of both of those PHEs in terms of look at, we're gathered here today physically, wouldn't have been possible over the last couple of years. They have represented a very good sort of learning exercise with regards to how we get these information flows, both coming in from the member states, but also from the industry. I would like to say that we have had 100% success in that regard, but compliance is a continuous challenge. And we do have to ask everybody to do better with regards to that. So actually, whatever else you may think about these critical lists and how we pursue the type of information, it's at least sort of giving us good exercise, good practice to do it for the next event, where maybe the heat will be and the pressure will be as intense as it was back in 2020-21. Okay, I then wanted just to go on to the preparedness activities, because this sort of is the grey zone between the MSSG, the task force, etc., normal circumstances. And again, if you can look at the graphic, I mean, here we are, the agency, we like to be part of the jigsaw puzzle, and look who we're dealing with. We're dealing with academia, we're dealing with healthcare professionals, we're dealing with industry, we're dealing with patients and consumers, and most of you guys are represented in the room here today. if you track over to the member state perspective on the right, it may be hard to visualize, but believe you me, largely those actors are the same. But very importantly, distributors show up there on the NCA, and that's the sort of detailed supply distribution arrangements, even down to the pharmacy or hospital level, and healthcare systems show up in the member states perspective as well. So in terms of getting real and valuable intelligence, it's absolutely essential that that sort of information flow through the NCAs is very efficient, and indeed is those sort of processes is what Chessman Joint Action Investments hopefully will raise capability on going forward into the future. And again, both of those streams get processed through the SPOC working party, elevated up to the MSSG as the executive steering function, and then collaborating with the Commission colleagues, Santi and Hera. One of the things, and Emer's always asking the question, what can we do really to make a difference, you know, and it's not just in this topic, it's in many topics that Emer asks that question, you know, to move the needle, make a real difference rather than another nice document sitting on the shelves in a metaphorical digital space. And one of the things we are trying to do is to sort of compile this toolkit of actions and activities, and it sort of tracks out, we think this is our emerging toolkit in this space, and we're not pretending it's complete, we're not even pretending it's the best, but this is what we've got to date. So left to right, European and international cooperation, because hey guys, it's a global business, we're in a global market and supply chains are global. Communication, absolutely key, and it's no accident that Melanie and Juan Garcia were really instrumental in putting this workshop here today, emphasizing that need for the communication activities. Regulatory flexibilities, and these are there, they're possible, there are discretion certainly at the member state level, they're supported by ourselves with the Commission backing, and they can be exercised and have been exercised not just in public health emergencies, major events, but also in national shortage type situations in so-called peacetime. Increasing supply, I mean, like, you know, it seems to be if you have a shortage, why not increase supply? Easier said than done. And there are a number of different ways by which that can be achieved, obviously with the primary marketing authorization holders, but also with exploring possibilities to get new entrants into the market to expand the sort of available supply. And indeed, that links in, and you'll hear then from Agnes as and when she picks up the HERA perspective as to how HERA can help in certain occasions, certain circumstances in addressing this supply challenge. And then finally, controlled distribution. Nobody likes the dirty rationing word, but at the end of the day, that's what it comes down to. And also then advice with regards to medical alternatives, because essentially we've got to address those essential needs and we've got to be flexible and adaptable in making that happen. So I just want to finish off just touching on two very real sort of preparedness activities, both of which have had reasonable high profile now in the last year or two. One being on the antibiotics, and the SPOC, again, as I say, right at the center of things, have been monitoring this since November 22. And of course, this has been a global phenomena with a major mismatch with regards to the demand for antibiotics vis-a-vis the global supply of these antibiotics. It seemed to focus in on the amoxicillin, clavulanic acid, and particularly with regards to pediatric formulations, with a sort of perfect storm post-COVID of not just the conventional type of infections, but with some atypical ones as well. What have we done as a SPOC? We've set up a sort of subgroup to investigate that type of shortage. So it really is all about getting those information flows, both with regards to the demand consumption at the member state level, but then also in dealing with the industry to sort of see what their supply challenges are. Similarly, with regards to the thrombolytics, and here we have a complete opposite, because with antibiotics, and it's a question which Lorraine touched on, who's really responsible for the antibiotic supply in Europe? There's not one company, it's not one member state, it's a multiplicity because it's a diverse and fragmented marketplace. And, you know, so where does the primary responsibility lie here? Not so easy to answer. Here in the case of the thrombolytics, we essentially have a monopoly situation, a single supplier, not just for Europe, but largely for the world. And this is what's very challenging. And we might have a good discussion in one of the breakouts as to why hasn't the market diversified for this particular product? Why do we only have essentially a single supplier? It's a good question to say, why isn't there a multiplicity of supply here? And you'd be asking more than one company to increase its supply capacity, or else going to non-EU producers, and there are a few out there, to say, hey guys, have you ever thought of coming into the European market? So they're both sort of two very challenging sort of situations that have been on the table now at MSG and Spock in the last couple of months. And with regards to how do we activate our toolkit, well, obviously then we do take discussions both at the EU level with the Commission colleagues and also internationally because of the global perspective, and in particular investigating with other regulatory authorities what sort of mitigating options we have and what sort of availability of alternatives are out there with which to sort of complement the European market. So that's one level that we can do. But also, very importantly, and it's back to essentially saying the ISPOC, the industry SPOC of network, when you activate in a given area, let's take the antibiotics, we really do reach out and are very grateful for the cooperation, the collaboration given by those authorization holders and manufacturers, which is voluntary primarily, in addressing communication issues, your manufacturing supply capabilities. Do you need regulatory flexibilities to be applied? And then investigating with the member states what sort of control distributions, restrictions are you putting in place essentially to ration or to preserve best use of these products. So that's essentially us applying a sort of best practice toolkit. It's very important to interact with the other stakeholders in that supply chain, in particular the wholesalers, the distributors, healthcare professionals and patients with regards to, primary use cases, both at EU and at the national level. We've had a recent run, actually. It started off back end of last year, fourth quarter, continued on into this year, where we actually front up with the companies. So the companies come in virtually, they address the SPOC, they address the MSSG, and there's essentially a direct communication. And this is the quality of those discussions, unlike in other circumstances, other part of the regulatory system, they are not adversarial in nature, they're very much collaborative in nature. It's a sort of shared problem because everybody wants to supply the market, everybody wants to meet the patients' and healthcare professionals' needs. So we're essentially inviting companies to come in and they voluntarily show up and they're very open with the type of information, what their as-is situation is and what their future state is likely to be. And that's very important for us to try to put the jigsaw together with regards to that future supply situation. Similarly, I've talked about the fact that we have contacts with other product developers or authorization holders in other regions, and again investigating the possibilities of, and there are exceptional measures to bring them in and complement the market in Europe in those exceptional extreme situations, if not even mainstream then if they pursue classical licensing conditions. The whole thing underpinned then with an extensive sort of communication outreach, both to sort of hopefully not to cause a panic or a stockpiling or a run, because that's the downside of communication when it comes to the supply shortage type environment, but very much more on the rational use of medicines. Take the antibiotics, reinforcing that measure. Antibiotics for viral diseases is just a waste of product basically. So are we happy with what we've done to date on the thrombolytics or the antibiotics? I would actually say no, we're not. Because the antibiotic situation is improving, but is that more to do with the weather getting better, the days getting longer, and the epidemiology changing, other than the actual fundamental supply situation? So what we're working at the MSG and as a system is we better reassure ourselves we avoid this situation fourth quarter this year into next year. So, because it was a close run thing was the experience over the last winter. And with regards to the thrombolytics, are we happy there? No, I don't think we can, because we don't have a secure solution there. And not only that, we also have pressure on another product, urokinase, which is sort of even restricting supply there, which is putting pressure on the thrombolytics in Europe. So this is still very much in the focus of the system to try to see how do we navigate this complexity, this challenge over the next weeks and months to come. So I'm on to my last slide, which I'm sure the chair is very happy with. So take-home messages, and it says EMA, but it really should say MSSG, frankly speaking. It's only because we host it. We are monitoring the supply and the demand for COVID-19 and monkeypox. We will look at these preparedness type issues outside of those rather classical sort of public health emergencies, major events, and the examples of amoxicillin thrombolytics, and there are others. The SMP is underway to deliver in 25. We will set up the device structures, and we do have close collaboration both with ECDC, HERA and Sante, and that I think is a good segue, Chair, to the next speaker, Agnes, who will address the HERA contribution on this topic.
Yeah, thank you very much, Tony. I think you very well addressed the resources needed by all the stakeholders and the pragmatic things we have to do and the flexibilities needed to address these topics. And now I would like to welcome Agnes Molnar, Deputy Head of Unit Intelligence Gathering, Analysis and Innovation at DG HERA. She was not able to join us here today. So over to you, Agnes, from remote, and please have a little bit time in mind that we have, in the end, time for questions. Thank you.
Good afternoon, and thank you very much for the introduction. Indeed, it's a great pleasure to speak at this workshop. It brings together stakeholders from various fields working together in relation to preparedness and response to health emergencies. And following the previous presentations, I would like to continue with an introduction on what HERA is doing across these areas. Next slide, please. HERA is a new commission service. It was created towards the end of 2021, and we had relatively little time to setting up functions while responding to the ongoing COVID-19 pandemic and other threats at the same time. HERA's core mission is to prevent, detect, respond to cross-border health emergencies by ensuring the availability and access to key medical countermeasures. HERA has an all-threat approach, and we are targeting biological, chemical, environmental, and also radionuclear threats, focusing on all types of medical countermeasures, vaccines, medicines, medical devices, and also personal protective equipment. HERA is taking an all-threat approach, and besides an end-to-end approach from intelligence gathering through R&D, procurement, stockpiling, and distribution of medical countermeasures. And all across these areas, HERA is closely working with the European Medicines Agency, Commission services, especially DG Sante, GRO, ECHO, RTD, and of course, member states, industry, academic stakeholders, and civil society. HERA was established in a complex set of initiatives. The next slide, please. And these initiatives include the reinforced framework on serious cross-border health threats, the strengthened mandates of the European Medicines Agency and the European Centre for Disease Prevention and Control. And all to these pieces, there's an additional element, the Council regulation on the emergency framework for medical countermeasures, which defines tasks for HERA in case of a public health emergency. Next slide, please. In relation to preparedness mode, HERA has tasks on threat assessment and intelligence gathering. This includes the prioritization of health threats and also medical countermeasures, monitoring supply chain, providing modeling and forecasts to rapidly identify gaps and needed response. The next pillar is to promote advanced research and innovation, to develop effective, safe and affordable medical countermeasures and also related technologies. This includes late-stage R&D clinical trials as well. As for production capacities, the goal is to address market challenges and failures in relation to production. This also includes flexible and scalable manufacturing capacities for EU. The function on procurement, stockpiling and distribution capacities includes the joint procurements at EU level with member states and also stockpiling capacities for the EU. HERA is also organizing training programs, and this is for capacity building together with member states. In emergency mode, HERA has a possibility to activate mechanisms for monitoring crisis-relevant medical countermeasures, establish an inventory of relevant countermeasures, and also production facilities, and also launch procurement, purchase, and manufacturing of these crisis-relevant products. There's also a possibility to activate EUFEB facilities to make available reserved surge manufacturing capacities. Next slide, please. Across all these areas, the last year, HERA has identified priority threats, guiding activities, also started developing an IT platform for intelligence gathering on threats and medical countermeasures. A main focus was on advanced research and development for innovative countermeasures under the Horizon Europe and EU4Health programs. And besides these areas, HERA started to set up the network of ever-warm manufacturing facilities for vaccines and launched a call for tender for EUFEB. Also worked on establishing stockpiles of priority medical countermeasures under rescue, including against CBRN threats. And throughout 2022, HERA started to prepare a future training program based on lessons learned from COVID-19, but also on other health emergencies. And these trainings will focus on analyzing gaps and needs in member states, also organizing tabletop exercises and targeted trainings in the area of joint procurement and stockpiling. HERA has established also collaborations with the member states, industry and civil society as key governance bodies of HERA include these stakeholders, EU institutions and agencies, especially, and MIE and ECDC are part of these bodies. And we established working arrangements with third countries and international organizations like the US and WHO. Next slide, please. And a few elements on crisis response, what has been done so far. In response to the ongoing COVID-19 pandemic, HERA is managing advanced purchasing contracts of COVID-19 vaccines, distributed over 1.4 billion doses of vaccines to EU and EEA member states. HERA also shared vaccines with third countries via COVAX and bilaterally. And in addition, access to therapeutics is managed by joint procurements with member states. Next slide, please. Beyond COVID, the response also focused on the Ukraine crisis. The emergency office of HERA is supporting response and also setting up donation schemes for medicines and vaccines. HERA purchased monkeypox vaccines and therapeutics, donated as well vaccines to member states, and initiated joint procurements to ensure access to medical countermeasures. Besides, HERA supported the mobilization of extra funds for clinical trials for the monkeypox outbreak and also for the Sudan Ebola virus outbreak in Uganda to support WHO. Next slide, please. In relation to the specific function of intelligence gathering and analysis, and particularly data collection, as a first step, HERA finalized the prioritization exercise to identify major threats to act on, and delineated three main threat categories, namely pathogens with high pandemic potential, chemical and biological and radionuclear threats originating from accidents or deliberate release, and also AMR as key areas of action. Following this exercise, HERA developed a catalog listing all medical countermeasures related to the three priority threats. And this catalog includes preventive, diagnostic, and also therapeutic medical countermeasures relevant for preparedness and response. This includes medicinal products, devices, in vitro diagnostic devices, PPE, biocides, and other products. From this catalog, different lists will be extrapolated to inform actions on research and development, on stockpiling, and also on monitoring of supply. This exercise involves member states, industry, civil society stakeholders, as well as EME and ECDC. The monitoring function also focusing on and aims at developing methodologies for detecting and addressing shortages, vulnerabilities, and strategic dependencies in the supply chain. And there's a joint pilot exercise between HERA and EME, which was already referred to on critical antibiotics. It's a key activity to further develop and streamline data collection processes. Next slide, please. In relation to crisis, as mentioned, the Council regulation lays down main rules and possibilities for HERA. This can be activated in case of a public health emergency. And the aim is to set up a list of crisis-specific medical countermeasures, complementing the list of EME and including other countermeasures such as PPE and raw materials. And based on this list, data will be collected from economic operators, national competent authorities on supply and demand to introduce measures to increase production capacity, also initiate procurements, reserve stockpiling, and others. Next slide, please. Still regarding data collection, HERA will have an anticipatory function to identify vulnerabilities, including dependencies, redundancies, and reliabilities, as well as provide early warning to react through HERA's function. And this reactive function aims at responding to actual potential shortage, identify expected supply and demand. The aim is to inform HERA's activities and launch stockpiling, procurement, scaling up production as needed. Next slide, please. And just to provide a picture of data collection and data sources, the data collection aims to build on data from producers, economic operators, member states, and national competent authorities, also looking into established databases. In preparedness time, this includes voluntary reporting on medical countermeasures on supply and demand, as well as information from member states based on mandatory reporting exercise. This is defined under the cross-border health threat regulation. In crisis mode, the data collection is focusing on the already mentioned list of crisis-related medical countermeasures and the emergency framework regulation. Next slide, please. Some words about HERA's tools complementing all this complex setup at EU level. And this toolkit includes different procedures and funding mechanisms, such as the joint procurement mechanism, capacity reservations under EU FEB, the Athena intelligence gathering platform under development, and of course, the Joint Industrial Cooperation Forum is an essential platform. This is established to identify and find solutions to supply chain bottlenecks and vulnerabilities for medical countermeasures. In relation to joint procurements, this is also a tool to support innovation, and it can help de-risking innovation based on risk sharing and co-sharing, but also support sustainable and long-term production of innovative medical countermeasures. Next slide, please. Just to finally mention some elements for action for 2023. This is the establishment and operationalization of the IT system for intelligence gathering, also supporting the development of innovative medical countermeasures, establishing reserve manufacturing capacities for vaccines, and HERA is establishing a pilot HERA fund to leverage private investment for the development of medical countermeasures. We continue to work on stockpiling, defining a stockpiling strategy, and establishing medical countermeasure stockpiles across member states. Thank you very much.
Yeah, thanks, Agnes, for presenting these impressive developments in a short time frame. Well done. So with that, we come to the last presentations in the first session of this afternoon, what happened with the HMA-EMA task force, and this will be done by Hugues and Monica. So please.
Thank you. So may I have my slide? Yes. Since we are running quite late, I propose that we accelerate a little bit, especially because for the first slide, I already mentioned the most important part during my introductory speech. So can I have my next slide, please? Yes, so regarding the main achievement, there has been the workshop in November 2018, we already mentioned, but more importantly, the release of two important guidance. One dedicated for marketing authorization holder with the definition of shortages and harmonized template for reporting shortages. And the second one would be for good practice guidance for communication to the public on medicines availability issues. Beside that, we have had we put into place the EU network of single point of contact, which has been instrumental to a lot of activities, and both Carl and the previous speaker have already discussed about that. We also made a link between EMA shortages catalog and national shortages register on EMA and HMA website, and we have had key information for shortages management and monitoring by EU regulators, the famous matrix. Next slide, please. When it comes to the main changes since November 2018, of course, we had to put on hold a lot of activity due to the COVID-19 business continuity plan, but we resume activities in mid-December 2021. At that moment, we decided to propose a new structure and composition. We developed a new work program to 2025. We have managed to update the term of references. And of course, there has been an extension of the mandate for 3 years. Next slide, please. Okay, so regarding the main changes, first we moved from 3 thematic working group into 2 thematic working group. Why? In order to get a better alignment between the different activities we have in the EU regulatory network, being EMANS, being the Joint Action on Shortages, JASMAN now called, and the extended mandate. And everything is put into place in order to secure that we streamline our processes, we foster synergies, and we try to do our best to avoid duplication of work within the network, knowing that, again, it's almost always the same people that have to deal with all those issues. Next slide, please. And I believe now it's time for Monica.
Yes, thank you. So that I'll continue with the presentation. And here I just want to reiterate the role of the task force as a supply and availability hub within the regulatory network. And this has already been mentioned by previous presenters, so I will be brief, but certainly we have as a starting point the EMAN strategy to 2025, in particular the theme on availability and accessibility of medicines, also some aspects of the supply chain challenges theme that have been incorporated in both the HMA and EMA multi-annual work programs, and those have been translated in the work program of the task force that we have today that Hugues already mentioned up to 2025. Now, because we need to take into consideration the other activities, initiatives and activities that are ongoing, such as EMA's extended mandate, the joint action, and the EC Pharma strategy. So we will use also the task force not only to deliver its own activities, its own work program, but to function as that hub for supply and availability initiatives to ensure coordination and to prevent duplication. Next slide, please. So the work program, as I said, builds on the AGMA multi-annual work program, EMA's single programming document, which is the equivalent to AGMA multi-annual work program. But we've also carried out some of ongoing activities from the previous work program, those that were important to have those finalized. They've also been carried on to the new work program. Then there are other actions related to availability of medicines that are assigned to working groups within the European Medicines Regulatory Network, such as the EPI and biosimilars, but are not actually undertaken directly by the thematic working groups of the task force. As I said, and I want to repeat, so this ensures alignment with the joint action, also with the EC Pharma strategy, so that we have as much as possible synergies and avoid duplication of the work of the network with already strained resources. And next slide, please. So what are we going to do and what are the main activities? So if we focus on thematic working group 1, availability and supply disruptions, there the group has put together a number of proposals for changes to the legislation to improve prevention and management of shortages. That work has already been carried out and has been fed into the European Commission initiative with the revision of the pharmaceutical legislation. Now, also very important and for discussion at tomorrow's session 3, we have the good practice for industry on prevention of shortages of medicinal products for human use. Now, there is also a focus on veterinary medicines, and what we will do in relation to the veterinary sector is the learnings from the activities and the guidance developed for human medicines then will be applicable also to veterinary medicine. So there will be then a discussion to see how to apply those to the veterinary sector. So another activity for thematic working group 1. Last but not least, and also very important, a number of activities in order to increase harmonization within European Union, but also collaboration with international regulators. So this has already been mentioned as a very important activity when it comes to the prevention and management of shortages. Now, if we move to the next slide into thematic working group 2 on communication. So here we have, and the task force has an enormous commitment to transparency. So it's very important to communicate to the public on medicines availability issues, and I think this will be again for discussion during this workshop, and it's a very important aspect. So a lot of work that will be done and is already been done by thematic working group 2, but also important having a good practice guide for patients and healthcare professionals on the prevention of shortages. This has already been done in collaboration with healthcare professionals and patients. And it's very important now to see not only this guidance, but other guidances that have been developed by the task force, how those guidances are being implemented and monitor that implementation. And of course, at the very bottom here of the slide, today's multi-stakeholder workshop, a very important deliverable of thematic working group 2 as well. Next slide, please. So I just want to finalize the presentation referring to these other activities that are also tracked, so they progress under the task force. So one is, of course, the implementation of the EPI project, very important to improve availability of medicines. There is a pilot that will start in the second half of this year, and that will include a small number of products nationally authorized as well as centrally authorized products. Now, in the area of biosimilars, we have a dedicated breakout session just after the coffee break, and where we will there discuss the statement that was published on a scientific rationale supporting interchangeability of biosimilar medicines in the EU. So a very important step there to improve availability of those medicines. Now, other important work ongoing within the European Medicines Regulatory Network is the promotion of the multilingual packs. This is work undertaken under our CMDH, and also there are other important work ongoing on development of guidance for a quick approval of medicines in countries where they are not authorized in the EU, such as the Day Zero MRP procedure. And last but not least, also important work towards the publication of information on marketing status for centrally authorized products in the EU. And this is my slide. So, Carl, over to you.
So thank you very much to you and Hugues for the last presentation. And Tony mentioned the Intelligence Center for Shortages. I think Monica is at the center of this Intelligence Center, and she is focusing on bringing all together these different groups here in the EMA, HMA network. So thank you very much. So we have now some time for a discussion and questions from your side, and we will do it then alternatively here from the attendants in the room and from remote as well. So please use the chat function, raise your hand. Monica is following up on what is then taking place remote, and we will take that into consideration. So we have heard a lot of information today, and the important thing is we are prepared, but what we will do in the future. And so please, I see over to you. Please introduce yourself. And
my name is Josie Drapwell. I'm from IPOPI, and thank you very much for this very interesting workshop. I would like to, first of all, refer to something that Mr. Giraud said, and I liked very much what he said. But I just wondered if I could add just a little something to his presentation, because he referred to the fact that plasma for immunoglobulin was only produced by unpaid donors. And I have to say that there are also remunerated donors who give plasma for fractionating. So that's all I wanted to say. Thank you.
yeah, thank you very much for this comment. So do we have questions? Not yet. So we have time here in the room. Please.
I'm Rina Vlasenko. I original Ukrainian, why I say this, and it's very close to work with this humanitarian. I live in Norway, but last year I was in Ukraine and coordinate some humanitarian help for people with diabetes. I really involved in this procedure. And my questions about humanitarian help. Do we have some regulation, because it's storage, in storage medicine, it depends sometimes of humanitarian help. Do we have some regulation which will be included in this documents on procedure, something like that? And also another, what we will do with expiration data if medicine finish his data. This is also a big, who will pay for this?
Yeah, thank you very much. Of course, something has been organized by the European Commission, and I would ask Agnes what can be done there. And I know as well that many member states helped with the Ukrainian situation on the national level, what they can do. So Agnes, please.
Thank you very much for the question. Indeed, HERA is supporting the crisis and setting up donation of medical countermeasures. Besides, there's a Union Civil Protection Mechanism, and we are working closely with the DG ECHO in relation to all types of crisis. So this is the legal base. There's a rescue stockpile at EU level, which can also be used in case of a crisis. So basically, that's the framework we are operating under. Thank you.
Yeah, thanks, Agnes. And then we have one question in the chat from Adrian van den Hoven.
I will read the question. Thank you for the interesting presentations. Most of the shortages referred to were caused by demand surges. What are the options to improve the prediction of these demand increases so as to reduce the risk of supply shortages?
So maybe I can start. We are addressing this in the MSSG, indeed, and there is no golden way of a solution. So we have to be pragmatic here as well. And what we are taking into account is to have an estimate for the further demand built on the experience we have, for instance, now during the recent crisis, and compare then the situation before the pandemic situation and then after the pandemic situation, now what we have seen now during autumn and the winter season with the flu and all the infections in young people, in older people, and to build on this experience and work together then with the industry stakeholders to have an estimate. But there's no golden way to say that is the demand for the next season. Nobody knows what will happen in the future. So we will do our best to have an estimate, but that's it. So.
Thank you, Mirjam Krul. I'm a hospital pharmacist from Amsterdam. I've learned a lot, so thank you. But I've heard a lot that we are going to make an EU list of critical medicines. And I'm acquainted with the WHO list of essential medicines. So I've failed to understand why we need our own list in the EU. And if we do, how it will differ from the global list of essential medicines.
Perhaps I try to address your question. So the lists of critical medicines that Tony presented on his slides are crisis-specific lists. So this is a list of critical medicines that will be established for a particular public health emergency or a major event. Now, in addition to that, there is a need to set up a EU list of critical medicines, and those are medicines that will be used during a crisis, but also in peacetime. But we need to ensure that there is continuous supply for these critical medicines. So these are the two different lists of critical medicines. Does that answer your question?
Yeah, I think we have the WHO list, we have other lists on this, and we tried that in Germany as well to find here a perfect solution. And we asked then the learned societies, patient organizations, and so on. And we ended up with a list of more than 500 medicinal products. So this is simply not feasible. And so we tried to find a risk factor-based approach. And then we ended up with a list of 100 medicinal products, which are then now are in focus of our agency. But still, it's not an ideal approach. So you never know that there's a new thing coming up. But this is a way to have a hint for a preventive approach. And we have to distinguish between the two lists. So the crisis list for the MSSG and the SPOC we are discussing is in the crisis situation itself. So here we are focusing then on a very small thing we can manage in a short time frame. And I think we have to distinguish that from the other lists, which are much longer.
I might just add a little bit more from a member state perspective to what Carl has sort of said there. And I know it can be confusing because there are many lists and what's the differences between the lists, etc. You know, when you really do review the medicines that are supplied into your marketplace, and I know in Ireland we had to carry out a really extensive exercise in the context of Brexit. And speaking of intelligence, that gave us such an insight into the supply chain, the dependencies and the vulnerabilities in the marketplace. And there were surprises in that, you know, when you look at it, because what we really saw, and there were things that maybe we wouldn't have had the awareness of before, when you really engage with health systems in specific areas, and you work in hospital pharmacy, so you will really kind of understand the nuance. We found that we had dependencies, you know, almost down to very small numbers of patients on older products manufactured by single smaller SMEs within the UK that we would never ever have known about. And were they critical? Yes, they were to those patients, because that's where the dependency was and there wasn't an alternative. So there is fluidity to this, and no matter what critical list you develop in what circumstances, there's generality, but then there is specifics, and it is something that needs constant review as well too. But as Carl said, it's, you need to start somewhere, and it is about identifying dependency and vulnerability, and then how you have that awareness and work to protect.
Thank you. You can count on us from the healthcare professionals to help you if you need. This is good.
That would be good to know. So we have some question in the chat. Rick Clayton from Animal Health Europe.
Thank you for a great set of informative presentations, and thank you, Monica, for reminding us that veterinary medicines are within the scope of the task force. That's very good to hear. Because I represent Animal Health Europe, the Association of Manufacturers of Veterinary Medicines. But something else you said, Monica, caught my ear when you were talking to your slides just now. You mentioned that some measures will be applied to the veterinary sector. And I was wondering whether you meant those precise words, because it sounds very definitive. And of course, our sector is entirely different, in market and issues. I was wondering whether what you really meant was these measures will be considered as well for the veterinary sector. And of course, we have our own workshop in a moment. We have already a new regulation, and certainly nobody will be looking to open that just yet. Thank you.
Thank you, Rick. That's exactly what I meant, is that there will be a discussion based on the work of the task force on availability of human medicines for the applicability to veterinary sector. So that will come. Usually up till now we have done most of the work of the task force in parallel for human and veterinary medicines, but the work program, as I set out, up to 2025. So we are developing a number of guidances for human medicines, and then we will have a discussion on whether they will be also translated into for applicable to veterinary medicines. But Lorraine, you want to add on that? Thank you.
I don't really have a huge amount more to add to your question, Rick. Monica's absolutely right. I mean, the intention here is to let the experience probably first of all move forward on the human side of things, analyze that, and then look at the applicability to veterinary as well too, because I think there is an acute awareness of the fact that the veterinary system has really gone through quite an incredible level of change under the new regulation. We are still in the process of embedding that in, and I think that gives us a different level of capability and a different level of infrastructure. So it is only right and correct to use the findings in terms of availability and shortages on the human side, marry that with the developments that have happened on the veterinary side, and make sure that the optimal system is put in place for veterinary medicines, combining those two factors.
Yeah, thanks, Lorraine, for this. And I have seen Charlotte.
Yes, thank you. Charlotte Roffian from France Asso Santé, patient organization. I just wanted to come back shortly to the list of critical medicines. And my fear is that there is a risk of confusion with the multiplication of lists of critical medicines. And I can speak about my colleagues who are already completely lost between the list of critical medicines which will be developed in France, the list of critical medicines in case of health emergency, and we now have the prospect also of other list of critical medicines with a revision of the pharma legislation. So I think that's something we need to keep in mind and to find a way to differentiate between those different lists and to be very pragmatic and informative for the general public. Thank you.
Yeah, thank you very much for this comment. And of course, we are well aware of these concerns. And that is the reason that at the MSSG, we are so reluctant to broaden the list now too much on the European level. And for the national member states lists, we have to take into consideration the national then practicalities and approaches. So the medical systems are not comparable. We have there still many differences. So we need the national lists as well. And particularly, there are special markets in the different countries. And I think there is no ideal solution to that. But we have to face it as it is.
But different names may help, because if we call them all critical medicines, don't help.
Well taken. So, and then I have seen you. Please go ahead.
Thank you very much. My name is Marcelo Gincavarel and I represent CPME. And I wanted to ask a question shortly on something that is very important for doctors when it comes to the daily practice. So actually having information on the shortages. And I would like to ask about, because this was mentioned, I think, during the presentations. So mainly for the strategy of the EMA network and for the upcoming revision of the legislation, if there is anything planned to improve direct communication for the healthcare professionals on the shortages, because I think doctors will agree that there is a big amount of time spent on the management of shortages, and that there's not enough information actually for the doctors in terms of notification about the shortages. So I just wanted to ask if you agree that that's an issue, and what are the plans to improve that in the future?
I'll maybe start on responding to your question, and Monica may pick up on elements that perhaps I miss out. I have to say, speaking from a member state's perspective, I think one of the things we have really focused on is healthcare professional communication and as much early advance notice of issues. And also, you know, in the event that we know a particular medicine isn't available, issue of guidance and advice on therapeutic alternatives. That is work where we very much so carry the intelligence into those responsible in Ireland for health service delivery. Then we work with those bodies and groups, we work with those that are responsible for issuing clinical guidance. And it really is a very tight interface. And I guess, you know, a smaller member state, very tight community, you know, we have made a lot of progress in that. But I would say every shortage that happens, and I guess particularly the recent examples of antibiotic shortages during the cold and flu season that we have just come through, we have learned, and we keep, you know, tuning and finessing that approach to make it better and to make it more meaningful. So I guess probably where a lot of the strength in this and that the kind of depth of the approach is, it's still resides with member state level, and that there is a benefit to that in terms of what I have outlined, because, you know, much of the clinical care actually happens through that conduit. But it is something, you know, that we are collectively mindful of in the network as well too, and we are looking at ways of constantly improving. One of the things I would also say for us, we do publish catalogues of shortages that they are very frequently updated every 2 weeks or so. One of the things that we find with that catalogue is it becomes very much so a focus on numbers, and we are questioning how meaningful the number issue actually really is to both healthcare professionals and patients, because, you know, very often we have different strengths. It's possible to manage dosing regimes. There are different forms, and there then are therapeutic alternatives. So the numbers are important, but the context of the situation also is important. But I think we all recognize the need for full transparency in this, because system, everybody has to work together. So Monica, I'll pass to you.
Thank you, Lorraine. But I think you've answered very well the question. Just perhaps to say that the situation that Lorraine has mentioned at national level, what we're trying to do within the task force is to have that harmonization across the member states. And one of the achievements of the task force was already that good practice guidance for communication on shortages. Now we've followed up with a number of surveys, so we need to ensure implementation in all member states. So we need to ensure that all healthcare professionals and patients have access to information in all countries. So that is the aim of the activities of the task force. So a lot of work there is ongoing in that area. We know how important it is.
So unfortunately, we are running out of time. So we have time for 2 further questions, but we have one by Arodis in the chat. So please go ahead. So, okay.
Thank you, François Hoyer from the European Organization for Rare Diseases. One of the proposals that caught our interest in the European Parliament report on shortages in July 2020 was the call to Commission and Member States to work on alternative sources for the manufacturing of medicines during a limited period when, for example, there is a withdrawal and we need to look for an alternative industrial partner to manufacture again the product. And we've seen how effective that is, for example, for Mpox vaccines, when some military pharmacies could produce the vaccine and increase the supply available in Europe, or other products used in rare medicines, probenicin, mexiletine, where hospital pharmacists could produce high-quality medicines during that period where industry had to reorganize the market for products which were withdrawn. So my question is it already part of the either regulatory strategy or the Commission ideas for the revision of the legislations? Thanks.
I think it's part of our regulatory flexibility, what we are already doing in crisis situations, and I'm pretty sure that Sylvain.
Maybe Agnès wants to come in because DG ERA is also looking at this in times of crisis. But anyway, as Carl said, there is a possibility already in the legislation for this type of products to be made available from hospital pharmacies or other sources. And in times of crisis, if it requires specific derogatory pathways at national level, that is certainly possible and has been the case. Yeah. So I don't know if Agnès wants to come in. Agnès, maybe on EU. Yeah.
Yes, indeed. We have the EU FAB project, what was mentioned, and we started to work on it, launched the call, and we'll continue in 2023 for flexible manufacturing capacities, emergency reserve and surge for vaccines. And besides, HERA also commissioned a study on flexible manufacturing in the last year. This is to assess potential options for consideration how to establish these flexible production capacities for therapeutics and vaccines at time of crisis. And this study is being finalized right now, and it will provide options and advice for strategic decisions in the coming years. Thank you.
Yeah, so thanks, Agnès. So then one last question, please, Mrs. Santos.
Yes, thank you. Ansela Santos from BEUC. Going back to the question of the lists, I would like to know if you could clarify a bit more the overlaps or differences between the list of main therapeutic groups that the EMA has also for crisis situations, and then also HERA's list on medical countermeasures. So what are the overlaps and differences, since both lists are going to be used more for, let's say, in crisis situations? Thank you.
Perhaps I can start and then I give the floor to Agnès. So as described in EMA's extended mandate and already in place, we had actually a deadline fixed in the regulation to develop a list of main therapeutic groups, and that's already published. The aim of having that list of main therapeutic groups is that when we are faced with a crisis, either a public health emergency or a major event, we have there a toolkit, so already an idea of what are the medicines that we required for emergency care, hospital care, and that is already in place. So that will help us then set up our public health emergency or major event crisis-specific list. And I know that it is too many critical crises, but apologies. So this is already foreseen in the mandate, and it's already been done. I think perhaps it would be better for me to hand over to Agnes to then explain the link with the medical countermeasures.
Thank you very much. Indeed, we are working together with EME and trying to ensure that there's no duplication, and we are building this work complementing each other's action. So for HERA, there's one list being prepared, a priority list of medical countermeasures, and this is for preparedness time. This is targeting those major threats which HERA identified as priority threats, and where we are is a catalog which includes different medical countermeasures against cross-border health threats, and this is broader than EME's mandate, so we are also dealing with authorized and unauthorized medicines, medicinal products, devices, also personal protective equipment, raw material components. So basically it's a very broad set of countermeasures which we are talking about, and this list will specifically inform HERA's actions. So different lists, sub-lists will set up to inform purchasing, procurement, stockpiling, R&D of medical countermeasures. So it's a very practical and operational list to support HERA's actions and decisions on what products we should act on and deal with. And this is done together with EME, of course. So basically, we are ensuring that there's no overlap. ECDCs, their member states, and also industry and civil society stakeholders. So this is for preparedness time, and for crisis time, there's a list of crisis relevant countermeasures, and this is based on the emergency framework regulation that we have to set up. And based on this list, there's a monitoring by HERA, and also different actions can be initiated. And this is again complementing what has been done by EME. So the work is ongoing to develop common templates and data collection processes. Thank you.
Yeah, thank you very much, Agnes. We are very happy that you are so interested, that we have many comments in the chat and the questions here. So unfortunately, we will address it then in the further sessions, and we take all these comments and questions into consideration for our further work. So with that, I would like to thank all the presenters and the discussants. So excellent topic we addressed here then in the afternoon, and we have coffee break. Thereafter, there will be the breakout sessions. You have all the instructions where to go here or in the remote way. And with that, I hand over to for a short wrap up to the chairs.
Thank you very much, Carl. So those that are here in the room can go outside for the coffee break, and then the colleagues that are following the biosimilar breakout session will stay in this room, and the others, you know already what is the room allocated to your breakout session. I perhaps just wanted to take the opportunity to mention that we have over 300 people following this workshop. So we have 100 in the room and over 200 online, either WebEx or following the live broadcast. So a huge interest in the discussions today. So we'll see you at 3:35